Hi, this is Tahawar Mahmood, and I'm hosting the second SISS Faculty Conversation Series. The topic of today's conversation is Life After COVID 19 Revolution in Citizens' Rights. Viewers, our world over the past few months has completely changed. The way that we live, interact with each other, and behave all has changed. This is an alien world to all, and we are entering a paradigm shift with respect to new protocols of how to live our lives in a sanitized manner and how to do business virtually. Does the government need to enter into a new citizens contract with us? And how will this biocentricity going to affect our everyday activities? To address these issues and explain what biocentricity means for Pakistan, I have with me today a biopolicy and biosecurity expert who has advised and consulted on this subject with the government of Pakistan and keeps a keen eye on the prevailing issue. Thank you, Omar Kausar Malik, for joining me in the SIS Faculty Conversation Series.
Thank you very much, Tahawar, for having me.
Umar, let me begin by asking you whether there is a link between COVID 19 and bioterrorism, or is it a conspiracy? Is there any evidence that China is behind this and doing it deliberately, and it deliberately introduced this virus into our environment, as some are saying?
Well, Tahawar, this is a very, as a first question, a very interesting question, actually. Um, you know, I'm a, I'm an international relations and world history student as well, and when I look at the past history and I look at whatever has happened since the First World War till date, nothing surprises me now, and anything is possible. Having said that, um, you see, my inclination is towards believing that the fact that this virus um, is not a natural virus. People have said that it's natural, and there are some who said that it's not natural. But when I speak to scientists, and when I look at data and studies which have been done on COVID-19, it is a fascinating virus. Now, there are many conspiracy theories, as you yourself said, in the world, you know, pertaining to what US did, what China did, what the labs at Wuhan and the US were doing, the role and of Bill Gates and Dr. Fauci and others like WHO. Um, but what I understand from the virus and the structure is, I believe that it's not natural because of the fact that it prevails everywhere, so it's geographically everywhere in the world. Now, the previous viruses which had come, which were of the same family, the COVID family, Corona family actually, all of them were isolated in geographical areas, like Ebola was there and other SARS was there and others. But this virus, the COVID-19 virus, is spread all over. So it's in the cold weather, it's in the warm weather, it's Mediterranean, everywhere. And it's because of the fact that this virus actually penetrates into your body and penetrates into the cells of the body. And then it actually changes its chromosomal structure according to the gene type of the host, which is the person in which it is. That is the reason we are told that this virus can survive and sustain in all these different environments and these different climates. This is also one of the reasons that now the WHO is saying that maybe this virus will sustain for another year, 2 years, or God forbid, more than that. So this is the basis of my understanding is that this is not a lab experiment gone rogue or gone bad, but is some kind of a tampering which has been done um, somewhere along the way, which has actually resulted in this. But at the end of the day, Tahawar, we as Muslims also believe that this is, everything happens for some reason. And Allah subhanahu wa ta'ala, shows his power in different manners. And he has brought this calamity on us, and inshallah, he will be the one who will take away this misery soon, I hope.
Thank you, Umar, for that clarification. And I hope our viewers have also found your answer to be comprehensive in this regard. Umar, if this is not a natural virus, does Pakistan have an overarching biosecurity policy in place? If yes, what are the main features of that policy? And if not, then why not?
Uh, However, you see, uh, Pakistan, like many other countries, and especially third world countries, um, uh, you know, I think we didn't know that this was coming. The COVID was coming, and nobody knew that COVID was coming. So it was obviously when it came, there was some kind of a crisis, and we thought that what's happening and how are we going to do things. Having said that, um, our our um, our technical people and the government um, has been working on for the past several years has been working on preparedness and readiness vis-a-vis biological warfare is concerned, biological terror organisms are concerned, and other things. And we've worked on it. Organizations and institutions all over Pakistan who are concerned with biosecurity and biosafety have worked on it. The dual use of bio, and one of the most important things is that Pakistan in 1972 signed and ratified the Biological Toxic Weapons Convention, which is BTWC. Then it ratified the Cartagena Protocol on biosafety. Pakistan is a signatory to the Convention on Biological Diversity as well, which Pakistan signed in 1992. But apart from the international protocols and international conventions that we have ratified as a country, Pakistan since the mid 70s has been working and developing its own protocols, its own acts as well. So we have a drug act, we have a plant quarantine act, we have a animal quarantine act, we have the Environment Protection Act, which is there. We also have Pakistan's Export Control Act of 2004. So we have all these things. Recently, since 2005, we have worked very robustly to develop our biosafety guidelines. These are guidelines to use organisms, living organisms, how to use them in agriculture, in health, in environment. How would they come in? How would they go out? As I said earlier, we already have a regime which talks about export. We already have a regime which talks about import. Then in the same year, nearby 2006, 2007, the government of Pakistan, the National Ministry of National Food Security, which is previously known as the Ministry of Agriculture in Islamabad, started working on the National Animal Plant Inspection Services, which is NEFIS. NEFIS is an organization, an authority, which looks at, inspects what is coming in and what is going out and what are the protocols for that. This is on the same guidelines as the United States has APHIS, which is the American Animal Plant inspection
Similar to
services.
this one.
Similar to this one. Then we also have another very, very important initiative which has been taken by the government of Pakistan, um, which is that the Ministry of Science and Technology developed the National Biotechnology Commission of Pakistan. Now, as you know, and you've spoken about it in your introduction as well, that this is so this era is the era of pathogen-based warfare, fifth generation warfare. Biotechnology talks about is the technology of bioorganisms. And for us to have a biotechnology commission is a very, very important step to streamline and formalize lots of different initiatives vis-a-vis they are to deal with organisms coming in, organisms coming out, public policy of these organisms, how to create their working standards, what are the protocols. On the other hand, the Ministry of Foreign Affairs, the Directorate of Disarmament at the Ministry of Foreign Affairs in 2010 and 11 also developed the National Code of Conduct for Life Scientists in collaboration with cross-functional ministries all over Pakistan. And what they did was that they developed the do's and don'ts for life scientists, which includes agriculture scientists, which includes health scientists, which plant scientists, which includes animal scientists. Everybody who deals with living organisms is a life scientist. So all these things have been done. These are the elements, as you asked, for an overarching biosecurity policy. To answer your question, no, we do not have that in a formal way, but all these elements are there. We have them, and when they come together, inshallah, we will have an overarching biosecurity policy. And we need such a policy, and we need such an authority. And this is something which is not new to us. We have already experienced it, and we already have an authority similar to this vis-a-vis the nuclear arsenal is concerned, the Pakistan Nuclear Regulatory Authority, PNRA. The government, I'm sure, is working on it. And I know that there are people who are working on it. And inshallah, we should have this authority and an overarching biopolicy soon. And with this COVID crisis looming on us, I think that now it is high time, and I'm sure that this is impetus to many who are working to get these policies approved and get these organizations approved from wherever they are stuck, and start working towards the right direction.
Thank you, Omar. You have explained it really well. You are a public policy specialist. How would you rate federal government's and provincial government's response to this pandemic? And in coming months, how do you see Pakistan surviving this pandemic? What measures should be taken that are already not being undertaken by the government?
You see, Tahawar, in my opinion, as I said earlier as well, that this is something that no country was prepared for. As of, let's say, 2020 beginning, January 2020. And for such a thing for which countries weren't prepared, developing countries or developed countries, first world, second world, or third world, nobody was prepared in that sense. So keeping that in mind, I think that the federal government, whatever they did, was an okay job. I would give them, from 1 to 10, I'll give them, a 7. But there needed to be much more things done. For example, the Taftan issue, the people that we brought from Taftan, we could have done a better job. The people who came from abroad initially, before the checks were in place, obviously we could have done a better job. No job is a perfect job anywhere. We keeping in mind that we have human resource crunch as well, keeping in mind the fact that we do not have, and we did not have actually, now we have it, but at that time we did not have the material to, the PPEs and the other material to work with. Our hospitals were under equipment, and they did not have that much equipment as well. So we did fairly okay. Not very good, but okay. But the point is not that, Tahawar. My worry is not the federal government in that sense, because after the 18th Amendment, obviously, the federal government can only advise, can regulate. But at the end of the day, it is the job and the responsibility of the provincial governments to actually implement these things, because they are the people on ground who know what is happening and what they need. And here in the provincial capitals and in provinces, I see a lack of understanding. Yes, you can debate and you can talk a lot about the fact that which province did what better and which province didn't do better. But at the end of the day, I think that we still are firefighting, and at this present moment, the time is for firefighting, because it's still, the peak hasn't hit. But I think that there needs to be a very, very concrete, conscious effort on the part of the provincial leadership to sit down, think very, very carefully, and incorporate the same biosecurity framework that the federal government prepares for itself, replicate that on a provincial scale, and roll that forward. For that, they need human resource, not human resource, any human resource, but technical human resource. They need to rely on technical people. They need to rely on virologists, on microbiologists, on biotechnologists. They need to rely on people who have worked not only in public health, but also have worked on the agriculture side, on the policy side of agriculture, on livestock, because these things are also now going to be vulnerable because of all this. Keeping in mind that there is a strata and there is a notion also that comes from China and from the US, saying that this COVID-19 was actually came from animals and was converted and transmitted to humans. So we need to look at that as well.
All right, Umar. Thank you, Umar, for giving such an explained answer to my question. Understanding whatever you have said till now, I believe that this needs lots of changes in the way that we live and behave. What, in your opinion, will be the implications on our citizens' rights?
Well, the citizens' rights also, have two different connotations to itself. One is the global connotation, and the other is obviously the local connotation. In both connotations, I think that as soon as the WHO announced and converted the threat level from an ordinary disease to a pandemic, our social rights, our civil rights, citizens' rights, as you said, they changed. The way that we live, the way that we think, the way that our future is going to hold, what the future is going to hold for us, all has changed. The way that we behave with each other, the way that we look at travel, the way that we look at gatherings, the way that we look at human rights. I think that the entire world has changed. You see, we used to say that, after 9/11, historians and political historians especially used to say that there's post 9/11 and there's pre 9/11. Now it is going to be, pre-COVID and post-COVID, and this is going to be the new normal. I think that not only the local, but also the United Nations needs to revisit its human rights charter, because now it needs to incorporate such things into its charter, which previously were actually identified as human rights. The right to speech, right to gathering, right to assembly, right to education in schools. All needs to change. I'm not saying that it should not be there, that it will change for the negative. COVID, where has brought in lots of issues for us as a human race. It has also brought a lot of positivities. There is employment now going to generate on different aspects. There is going to be, distance learning is the new norm now. ICT is the new norm now. E-governance will be the new norm now. We all are sitting home, working from home. I don't know till when is it going to last, but there are organizations already announcing that we are going to make sure that our people, our employees, stay home and work from home, maybe till 2020, 2023. In fact, Twitter said that our workers can work from home forever, till they don't decide otherwise. So these new normals have to be incorporated into some kind of a social agreement and social contract with the population, with citizens, globally as well as nationally. But on the other hand, also, where it is an advantage in some cases, it is a disadvantage on the other cases where vis-a-vis health is concerned. There is a governance issue as well, which is hidden in all this. And that is that the countries would have to make sure, and especially countries like Pakistan and the third world countries, would have to make sure that the marginalized communities, the communities which are far-flung, the rural communities, where they have a one-room school, and sometimes they don't have schools as well. They sit under a tree and they study. How are they going to get social distancing implemented there? How are they going to enable them to either study online or through other technological methods? That is going to be very important. So where it is a challenge for our medical staff, for our scientific community, and for our biosecurity apparatus, it is a challenge for our governance people as well, for our public policy makers as well, for our legislators more also, that they need to develop and make and pass such legislations and give it to the policymakers. And the policymakers need to implement such policies which are COVID-friendly policies, which are policies that keep in mind the new normal, the bio-age normal, as I say. So all these have to be implemented. But for that, however, to happen, there needs to be unity across the board. There needs to be, all of us need to come together, whether it's the scientist or the policymaker or the governance person, or the medical health person. Everybody has to come together, sit, brainstorm, come out with a perfect solution or near to perfect solution, so that we are able to provide and facilitate to those masses, for which actually it is going to be a problem getting through this COVID crisis.
So, Umar, if I conclude what you have said for my viewers, uh, I asked you 4 questions and I noted down 4 points out of your answers. The first point is that based on your understanding of the structure of the virus, you think it is not natural but tempered. The second point, which I mentioned down, is that we have all the elements of an overarching biosecurity policy, but it needs to be formalized. The third
Yes.
yeah, the third point which I noted down is that, as I understood, if we have a formalized policy in the center, we still need all the provinces to have their own biosecurity frameworks or apparatus. And the fourth point is that all this needs to be incorporated or considered while reforming or re-evaluating a new citizens contract globally and locally.
Yes, you see, the citizens' contract needs to be multifaceted, Tahawar. Um, I think that when, inshallah, we come out of this this present crisis, which persists at the moment, um, I think that then we will settle, and the intelligentsia and the policymakers and the legislators would sit down and realize that there are many things that need to be incorporated. Number one, into our um, into our human rights, paradigm, into our constitutional framework, maybe, uh, but more so, it has to be incorporated and it has to be indoctrinated. And when I say indoctrinated, I say it with a lot of conviction, Tahawar. It needs to be indoctrinated into the people's minds that safety from this virus is imperative. We have to abide by this. We cannot do this, that the government softens the lockdown and we rush to the markets, and we do not care about any kinds of things. Yes, death and life is in the hands of God Almighty. God also, our prophet said that please tie your camel first and then talk about that God will save you. So it is very important. Until and unless we do not indoctrinate the safety mechanisms into our people, that is, whatever you and me have discussed will all be futile. We have to indoctrinate. And for that, our media needs to be very much proactive. Proactive in educating, and till date, let me also say this at the end, that till date, since the COVID crisis has come in, our media has done an impeccable job in actually highlighting and telling us that it is something to fear. It is something to not to take too lightly. But in the coming days and coming months, I think that the job of our media will increase. The job of our educationists will increase in educating and awareing the public on the massive calamity that this is, and how to make sure that we are safe and we go about our lives, but being safe and then going out. That is going to happen.
It was a very thought-provoking and insightful discussion, Umar. It is always a pleasure talking to you. I thank you. I
Same
thank you
here.
for being our guest. Viewers, thank you for your participation and time. Hope to see you again soon. Inshallah. Stay safe. Allah Hafiz.